We need to fix these immediate issues to deal with this crisis to help people now. Two things that I'm concerned about. It's the time and it's the cost. The cost of coverage. We're not going to get into the cost of healthcare after you're paying for your coverage in this session. That's a bigger issue to talk about. But the cost of coverage. If you are on the ACA, if you've ever signed up for it, my family has gone through this process twice, you do not get coverage immediately. You have to wait to the first of the following month. So if I went to the ACA today, I would start my coverage May 1st. So if you were laid off on, let's say, March 28th, okay, so that means your employer-based coverage would probably end on the 31st. In that period, how many people are going to be ready in this stressful time? How many people are going to miss the opportunity to go in to do the ACA quick enough to know that they can do that? Because, our information, we weakened that marketing around that as well, the Trump administration. So in those 3 days, how many people are left where then suddenly they say on April 4th, they went in and started investigating, figured out the ACA, but guess what? They're not covered now until May 1st, right? That's the problem. Oftentimes, if you go on the ACA, you're going to get a plan where maybe not all your doctors are covered. That is an issue. And so if people are opting right now to say, I need to keep my COBRA because I have to keep those relationships because it's critical to my health, what do we need to do? We need to make sure we have subsidy in this next stimulus package or urgently for COBRA. So subsidies across the board for both to address this cost issue. We also, of course, need to make sure that this is not just people that lost their coverage because they lost their job. This is also about people that are already underinsured. There are junk plans now on the market, and also people that never had coverage because now you don't need to make that choice. We're in a gig economy. People can't afford coverage, and so they don't have coverage. So we need to open up the ACA for everyone for that. We need to close these waiting times down and make sure coverage is immediate so people can get the care that they need. We are a chronically ill country outside of what is happening with COVID. And this is extremely concerning. And as we move forward, will be our next healthcare crisis if we don't address this quickly.